At Baptist Health Hardin, we know our clinical nursing staff has a unique perspective that makes them essential to decision-making regarding practice and the practice environment. Our shared governance councils allows nurses and staff to use their expertise at the bedside to directly impact department and hospital-wide policy. In 2020, Baptist Health Hardin implemented the following staff-identified improvements or needs to support patient care. Airway carts were added to all COVID and critical care units to improve access to resources necessary for intubation. Resource nurse positions were created for 3 North Tower, 4 North Tower, 4th floor, and 5th floor to ensure quality patient care, oversee nursing operations, provide education, and implement Baptist Health Hardin practices and policies. iPads were provided to departments to facilitate communication between staff, patients, families, and providers. Trimmable midline catheters were also authorized to give medications or fluids through a vein. Department leaders also made significant contributions to shared decision-making efforts. The diagnostics department began offering pediatric cardiac diagnostic procedures in partnership with Cincinnati Children's Hospital to provide essential screenings to our youngest patients. Disease management created a diabetes-specific case manager role to support patients with a diabetes diagnosis. The Progressive Care Unit began the important transition to exclusively private rooms, a need that was only exacerbated by COVID-19. The pandemic also demanded new policies and procedures, many of which necessitated feedback from bedside staff. Together, Baptist Health Hardin, nursing leaders, and staff developed COVID-19 patient care processes. Nursing leaders also partnered with the HMH Foundation to apply for patient-centered grants to care for patients. These grant applications translated to $300,000 from COSAIR charities for resources in the neonatal intensive care unit, birthplace, and the emergency department, and thousands for our sexual assault nurse examiners program from funding sources like the Victims of Crime Act and the Violence Against Women Act. Through everything, the Shared Governance Councils hosted a variety of activities for leaders and bedside staff, as well as multiple celebrations. Nurses have effected meaningful change across our healthcare system, and we look forward to growing and nurturing all of our nurses.